Pulmonary function tests evaluate how well the lungs are working. These tests measure airflow, lung volume, and gas exchange. Pulmonary function tests are non-invasive and safe. Spirometry is the most common pulmonary function test. Spirometry measures forced vital capacity. Spirometry also measures forced expiratory volume in 1 second. Low airflow values suggest obstructive lung disease. Normal airflow with low volume suggests restrictive lung disease. Body plethysmography measures total lung volume. This test accurately measures how much air the lungs can hold. DLCO measures how well oxygen transfers into the blood. Reduced diffusion indicates lung tissue damage. Bronchial challenge testing evaluates airway sensitivity. This test helps diagnose asthma. Cardiopulmonary exercise testing evaluates breathing during activity. Arterial blood gas testing measures oxygen and carbon dioxide levels. Blood gas tests assess respiratory efficiency. Chest X-rays provide an initial view of lung structure. CT scans offer detailed images of lung anatomy. High-resolution CT detects fine lung abnormalities. Low-dose CT is used for lung cancer screening. PET scans identify active or malignant lung lesions. VQ scans assess air and blood flow in the lungs. VQ scans help diagnose pulmonary embolism. Thoracic ultrasound detects pleural fluid. Tests are ordered for chronic cough or mucus. Shortness of breath is a key reason for testing. PFT results guide treatment decisions. Obstructive diseases are treated with bronchodilators and steroids. Restrictive diseases may require oxygen therapy. Infections are treated based on imaging findings. Proper preparation improves test accuracy. Loose clothing helps normal breathing during testing. Pulmonary tests play a vital role in diagnosing lung disease.